Welcome to the Volvet Voice Podcast. We're bringing you the stories of knowledge, compassion, and discovery from the University of Tennessee College of Veterinary Medicine, located on the campus of the Institute of Agriculture in Knoxville, Tennessee.
The whole idea, the whole bottom line behind GFI 263, transitioning over-the-counter antibiotics to prescription antibiotics, is to prevent antibiotic resistance in humans. There is a concern that using human medically important antibiotics in our animals, and when I say human medically important, I mean penicillin, sulfas, those oxytetracyclines, those type antibiotics, using those in our animals and then we consume those animals that it's been used on will infer antibiotic resistance to us.
Meet Dr. Lou Strickland, Extension Veterinarian at the UT Institute of Agriculture. In this episode, Ashley Self, a licensed veterinary medical technician at the UT College of Veterinary Medicine, talks to Dr. Strickland about guidance for industry number 263, also known as GFI 263, a broad effort by the U.S. Food and Drug Administration to combat antimicrobial resistance, a serious threat to animal and public health.
Well, welcome everyone. Thanks for joining us. I'm happy that we're here today to kind of talk about some very current situations in terms of over-the-counter medications that are now going to be changing to prescription. But I have Dr. Lou Strickland here. He is one of our extension veterinarians. And before we get going, I just kind of want you to introduce yourself and kind of say how you got to where you are, and maybe just a real quick snippet on what is extension in case people aren't aware of extension.
Okay, thanks for having me this morning, Ashley. As she said, I am extension veterinarian with the University of Tennessee here in the animal science department. I also have an appointment in the large animal clinic. As far as what I've done before now, I was a dairy farmer for about 25 years. Then I have been in large animal practice for about 25 years. And extension veterinarian, extension is just an education system. It is there to help producers with operation of their farms, but it also extends out into 4-H to be able to help 4-H youth. Also extends out into families to help with management of households, finances. So there's several different areas that extension reaches out into. And kind of what we're looking at today is back in 2017, there was a change to feed-through antibiotics where medications were put under the supervision of a licensed veterinarian so that these medications could not just be used rampantly through the animals that we consume. At that time, there were plans for the new guidance that's come along. It's called Guidance 263. And what that guidance says is that over-the-counter medications, injectables, oral, boluses, intramammary products that are used for treating mastitis, all of those will now be put under the supervision of a licensed veterinarian. Once again, kind of looking at reducing the use of antibiotics because there is a concern in the medical world that using these human medically important antibiotics, and when I say human medically, I'm talking about an antibiotic that would be used on us that is being used on our animals. And now we're consuming those animals that we use those antibiotics on, and then there is that concern that resistance will then be inferred to us from using those same type antibiotics.
Do you mind, can I jump in and just ask a quick question? In terms of the over-the-counter changes, is this specifically antibiotics or are there other medications that are falling under that change as well?
Great question. I've had that question asked quite a bit as well. This only concerns antibiotics, and when I say human medically antibiotics and the ones that will be affected by this change specifically are penicillins, sulfas, any sort of ampicillin, those type of antibiotics. Tylen's another one that's used that you can typically buy over the counter. So all of those will be affected by this new guidance. This will not include dewormers, pesticide, insecticides, those type things. Those will not be involved with this. I think I said vaccines. They will not be involved with this whatsoever.
Great, yeah, thank you, because I think could be a lot of questions just around, hey, how is this really going to impact me in all things in a specific area? And it sounded like you were kind of heading that direction, but if we start with maybe resistance, antibiotic resistance, why, and I know you had said because of the human aspect to antibiotic resistance, but can you maybe just talk a little bit more about, what is antibiotic resistance and why that does really matter to really the farmer and animal and people?
Okay. Antibiotic resistance in a very specific definition is where if there is an infection by, I'm just going to say organism X, and an antibiotic is used for treating that particular infection, that antibiotic does not respond whatsoever to reducing that infection because that organism is resistant to that antibiotic. And then what has to be done is a different antibiotic has to be reached for. In terms of that producer, well, now that producer is now using an antibiotic that's ineffective. Animal is still sick. We've got to reach for another one. And now we've got an animal that's still sick. We also have an animal that can not go into the food supply, and now we're running into economic issues of where that producer is literally throwing money away. But as far as us, if we go in for, once again, infection with organism X, and quite a few have probably heard about the methicillin resistant staph infections that occur. So now if we have that infection by organism X, antibiotic is not working. Now we run into issues of sepsis, maybe losing a limb because I'm just gonna say I've got an infection in my foot, and then that's not responding. Infection continues to grow worse. Maybe the only way to control that would be to amputate, or if the sepsis gets bad enough, I may even die from it.
And so why is, when you think about it, if I'm using antibiotics and we're saying there's resistance from me using it, what's the difference when you have maybe a little more oversight from your veterinarian in terms of limiting that antibiotic resistance?
Okay, I often explain this in my producer meetings that I go to, why this is so important involving that veterinarian. Number one, we're kind of looking at reducing that resistance because that veterinarian would have a working knowledge of how that antibiotic works on infection X, or that veterinarian will do a culture and sensitivity to know exactly what antibiotic to use in that situation. So the whole idea is, once again, is to try to slow down any sort of resistance and also to be more effective with the use of that antibiotics and then have a knowledge of what antibiotic is going to work best in what situation.
Yeah, great. So just that kind of added layer of they're not necessarily unsafe. We just need to be accurate in how we're using them.
I often have producers ask me this question too. What will have to take place with this new regulation is a producer will need what's called a VCPR, a veterinary client-patient relationship, to be able to get a script, to be able to purchase these antibiotics. Very similar to the way you would visit your physician to get a prescription, then you would go to your pharmacy to purchase these, whatever medication that physician has prescribed to you. So with this veterinarian having a intimate working knowledge of that farm, that way that veterinarian is going to know how things work on that farm, what's typically seen there, how things are typically treated. It may be known that, and I'm just going to throw this one out there, that mycoplasma has been seen on this farm before, so that veterinarian just knows real quick, okay, I know we've seen mycoplasma there before, a good chance that that's the problem, but we would still need to do culture sensitivity just to make sure that that is the culprit.
So important in establishing kind of veterinary care, so you have that outreach for this.
Very much so. What will be extremely important is to go ahead and establish that VCPR. Now, and what that VCPR means, and this will vary depending upon states, but all states are extremely similar. To establish a VCPR, the whole guideline is that veterinarian has to have an intimate working knowledge of your farm and is taking on responsibility for clinical judgments on that farm. That veterinarian has either visited your farm or seen your animals at their clinic within the past 12 months. And then that veterinarian has to be available for follow-up in case there's some sort of adverse event. So I highly encourage everyone to go ahead and establish this VCPR now. I will say this, under the guidelines of the VCPR, you don't have to call your veterinarian to give an injection, but I highly recommend that you do. And also recommend you do the same thing with a vaccine or with a dewormer, that you consult with your veterinarian instead of just grabbing the products and just administering them to your animals. That way you've got some sort of extra set of eyes going into this whole process, because I know this well too, because I was in the dairy business 25 years and we all still do this, is there's a term called barn blindness, where you literally walk by something on your farm or operation, whatever, every day, and you literally don't see it whatsoever. And now that I think back from my years on the farm, yes, we all do it. I've done it. And just to have an extra set of eyes or an extra set of opinion there can easily go, well, have you noticed this on your farm? This might be one of your problems here that's causing issues.
Yeah, that's great. I think there's more than just having the vet be there to write a prescription for that. They can help with prevention. They can help catch things early that maybe you're not seeing just because it is something that you're going past every day.
Correct.
Real kind of backtracking just a second for the vet-client-patient relationship that you're referencing. So it sounds like they're not going to be able to do telemedicine, because I know that's kind of an ever-changing thing right now, where maybe you have access to call your vet and do a telemedicine type of appointment. Do you know if that will fall in line in terms of a box to check for establishing that veterinary care?
Another great question. I've had multiple producers express to me that what are we going to do, Doc? We can't get a veterinarian into our area, or we don't have a large animal veterinarian. During COVID, this VCPR was relaxed a little bit. You could do some telemedicine during that period, but now since we've kind of gone back to normal, and I say normal as a setting on a washing machine, but still we're kind of back to what we call normal now. The VCPR regulations have been more strict as they were in the past. However, with this new regulation coming along, I think some states are having a look at this going, okay, what can we do about it? And I know for a fact that Alaska has already passed this bill to where a VCPR can be established through electronic means, especially in these areas that are extremely rural, that veterinarians have to fly in an airplane out there to get to them. I know some of those regulations have been relaxed there. That bill has been passed. You can do that through electronic means. If other states will follow suit, I'm not sure. That's yet to be seen. So that's something to keep a watch for, to make sure if there's some sort of changes coming along with the VCPR. Once again, you can discuss that with your veterinarian, or you could even get in touch with your House of Representatives or that type thing to see what's going on in the state, or maybe even your veterinary medical association to see exactly what's going on with the VCPR regulations in your state.
And it sounds like some of this maybe has progressed since 2017 with the veterinary feed directive changes, and now we're moving into that over-the-counter prescription change. But when is the, if you will, hard deadline on, hey, this actually like tomorrow, not today, tomorrow, but what is the feel for when this is absolutely going to be the only option?
Okay, when the VFD kicked into gear in January 1 of 2017, it was flipping a light switch. Boom, we've changed. Everything's different now. This is going to be slightly different. The date we've been told is June the 11th of this year, 2023. However, in a meeting that we've had with FDA, it's going to be just a little bit different. If you find a bottle of antibiotic X, and I'm just going to say antibiotic X on the shelf, and it has the old label on it, and I guess I should say current label on it, you can still purchase that antibiotic without a prescription. But FDA, USDA, Center for Veterinary Medicine, is working with these drug companies to change the label. So the current label would say you can purchase this just over the counter out the door. But the new label will have a statement on it, caution, this medication can be used only by the order or prescription of a veterinarian. So that'll be something important for you to do when you go in, to look on that bottle to make sure what that label looks like. And I often tell my producers, my veterinary students, everybody, always read the label. The label is going to tell you a lot of information. So you'll need to look on that label. I will say this. This is what also FDA is telling me, that these new labels, or antibiotic X with the new label on it, will only be in a location that has a pharmacy. So you may not be able to walk into your mom and pop feed store anymore and pick up these antibiotics and there they are, because they probably won't be there at all. I've heard, I don't know this for 100% fact, but I've heard Tractor Supply says they're not going to do this. In my mind, I'm just envisioning that it's going to be the larger feed stores like co-ops that have veterinarians on staff that are going to participate in this. Also, something else that goes along with this, this will be for all animal owners. This will not just be food animal producer owners. This will be for everyone. Dog owner, cat owner, horse owner, pig owner. It'll be everyone.
Yeah, so it's a pretty large impact in terms of...
It's a large impact.
Yeah. Thinking about, because the prescription was a question I had too, in terms of, okay, I get the prescription from my vet, but now where can I get this? Maybe it sounds like maybe there's some changes even in terms of how close it is. I don't know if there's online pharmacies that maybe would have that option for now. But yeah, that may be something to be mindful of too, and think about.
There will be. Often, when I was back in practice, this is the way I did it, because I simply did not want to keep up with inventory of a pharmacy. I used online pharmacies, and this will not be a problem whatsoever, that your veterinarian can call into this, whatever, pharmacy X, once again, whichever one you want to use, and can be purchased online. As far as physical, up in the air, still very fluid as to what's going to happen. We're not 100% sure yet.
Okay. So I personally find and kind of know that there is extreme value in having a veterinary relationship and having the veterinarian out to your farm. But if I do kind of step back for a minute and think from the opposing side in terms of, wow, this is potentially now an extra cost for me as the farmer to have a veterinarian come out that maybe I wouldn't have previously had to incur. Can you give us a little bit of support or reason of maybe what your thought process is, and when you're working through kind of understanding, hey, this is what my thought process is when I'm thinking about treating this animal, this is why I can be of benefit, and maybe speak to that extra cost and maybe where you see that still being of benefit?
I wished I had come up with this statement myself, but I actually borrowed this from one of my extension fellow extension personnel, I've never seen a vet charge more than what it's actually worth to come out on the farm and provide that service to that client. I realize a lot of times we go, boy, here's the sticker shock. But when you think about the economics of being on a farm, you're depending on that farm for your livelihood, and you're losing animals, and you're questioning yourself, what in the world's going on? Well, if that veterinarian had been out there helping with this, being able to diagnose or have certain health protocols to maybe ward off this, or maybe help you with a biosecurity program on your farm, well, I just see that as invaluable. I don't see that you can put a price tag on that. Once again, I constantly get it. Doc, they're charging me, oh my Lord, they're charging me $500 to come to my farm. Well, what if you've lost one animal? That's and that veterinarian then helped you sell, I'm just going to say, 5 additional animals on that farm. To me, that's invaluable. That's just, to me, like I say, once again, I was in the dairy business 25 years, and I look at that as just the price of doing business.
And so it sounds like, so let's say I had a condition where I needed antibiotics on my farm, and I had you out and you wrote a prescription for what I needed, and maybe 2 months, 3 months later, I'm like, well, crud, I'm in the same spot, I need medication. Is that something where the prior prescription could have refills where I could kind of stock this in a sense, or would I have to have the veterinarian out again for every time I'm seeing said condition?
Once again, great question. I get that question all the time. This is a little bit different than you visiting your physician, where I see my physician today, I get antibiotic to treat it with or medication to treat it with. I clear up. 4 months down the road, I'm feeling bad again. Well, you have to go back in to see your physician to be treated again. Not so much with this one. Once again, if you've established that VCPR, that veterinarian does not have to come back out on the farm. Sure, I recommend it. Once again, barred blindness, I go back to that. Another set of eyes, but you're not required to. You can call in your veterinarian. Your veterinarian could have initially set up refills. I often did that when I was in practice. I would set up refills. But you can call that veterinarian, and that veterinarian can write you a script, either electronic means for online, or you could run by the office, pick it up, and go purchase the antibiotics. So you do not have to have the veterinarian back out.
That's great. I think that can definitely ease minds a little bit in terms of maybe it's not every time, but still important to think about the advantages of hands-on veterinary care.
Correct.
Now, let's say this isn't a thing that has really changed because of the prescription change, but with storing these medications on the farm and knowing that it's an antibiotic, what are some things that I need to be mindful of in my practices in storing them on the farm?
Another great question, because I've had multiple comments. Well, Doc, I'm just going to run out there and buy up all I can and stock it on the farm. Bad idea. These antibiotics have a very specific shelf life. That's extremely important that you pay attention to that shelf life. Also, once again, remember I said that label gives you quite a bit of information. That label will tell you exactly how to store these antibiotics or medications in a very specific manner. So I highly recommend that you're paying attention to that label, the expiration dates. Another, consult with your veterinarian. Doc, how do you store them? How would you store these? Not a good idea to just stick them on the shelf at the barn where temperatures can range 30, 40, 50 degrees in one day. Look what we've done here lately. Heater in the morning, air conditioner in the afternoon. So, the temperatures can change quite a bit. So it's very important that you store these drugs and pay attention to those labels. And once again, here's something else to pay attention to, and this all goes back to the context of a VCPR. Under that VCPR, when you make that agreement with your veterinarian, you are agreeing to that veterinarian's instructions. So you need to use those medications as instructed by the veterinarian. because there is a term called extra label drug use. When you use it in a manner other than what's on the label or however that veterinarian is telling you to use those, that's now considered extra label drug use, and that's illegal. And also, if these antibiotics expire and you use them past the expiration date, we no longer know an established withdrawal date. And also, that's considered extra label drug use. So, once again, consult with your veterinarian, pay attention to the label.
I'm going to assume that most people listening and interested in this kind of know what the extra label drug use is and what withdrawal time is, but do you mind, just in case, to go over what those two things are for anybody listening that might be unsure?
Okay. First, extra label drug use is using that drug in any other manner than what's listed on the label. Whether that's you change the dose, you change the duration, change the route of administration. Those are extra label drug uses. And as I just said, that's illegal. Now, if your veterinarian writes your label and says to use it in such a manner, well, you're now covered. You're covered by that veterinarian. So now that veterinarian's liable, not you. And I am also the BQA coordinator for the state of Tennessee, and we don't like to see residues in the meat. So if we use that drug in an extra label manner, now we have to worry about residue concerns. So that's something else on extra label drug use. All right, now withdrawal period. Withdrawal period is that period from when you give that medication to when that animal can now be marketed for food production uses. So that's very clearly labeled on your bottle. And if you use it in the manner that it's listed on the bottle, exactly the way it is, we know that withdrawal time. But once again, if you go outside of that, label, or you use it past that expiration date, now we no longer have a very reliable withdrawal time. So that's why it's extremely important to pay attention and follow those directions.
Great. Yeah, thank you. And something, for me, being in veterinary nursing or veterinary technology, something we tend to think about is needle usage that comes with administration, and reminders to change out your needles, reminders for safe disposal of your needles. I do believe it's actually safeneedledisposal.org that you can go and investigate in your state where some drop stations are that you could take the collection of needles and safely dispose of them. So please don't put needles in the trash. And please, if I can beg you, change your needles between animals when you are administering some of these medications.
There are multiple diseases that can be transferred through not changing needles. Needles are cheap. It doesn't take but just a minute to change them.
Yeah, great. In terms of, this is maybe slanted a little bit more towards the veterinary profession, but do you see this causing a little bit of a strain on veterinarians, right? Because we know, hey, there's probably already a shortage of large animal veterinarians, and now potentially farmers are resorting to some of the small animal vets to try to help fill those voids. What's your kind of support or response to maybe some of that thought?
Correct. I've had multiple producers make the comment, well, veterinarians lobbied for this new regulation. No, it didn't, because this is going to create a lot of extra work, a lot of strain on both sides. On producer side, where they can't find a veterinarian, strain on veterinarian side, where they feel that obligation. Hey, I took an oath when I became a veterinarian to help for the relief of suffering of animals. So now I feel an obligation to try to get this done. And I've got 10 things on my plate already, so I see it causing a lot of stress on both sides. And it's going to be difficult for a while. I've also had this happened when the VFD came out. I had veterinarians calling me, asking me, well, I'm a small animal veterinarian. I've got a producer that's coming in. I see their dogs and cats, but I don't see their cows or horses or whatever. And they're asking me to write a VFD for them. What should I do? Well, the regulations don't say anything whatsoever about what veterinarian can write this VFD, and it's going to be the same way with this prescription. There's not any regulation that says what veterinarian can write it. I just highly encourage that the veterinarian that's writing that script also is the one that's seeing that animal or has the intimate working knowledge of that farm. Because there's consequences for, once again, using that medication in manners that it's not supposed to be used, or the residues, that kind of thing. So I just highly encourage that the veterinarian writing the script is the one seeing the animal.
Yeah, and I think just, from farmers, I know we all get in a pinch, right? And it just seems real easy to ask somebody, we're already taking our animal there, or they're coming out to see our small animal. But really, I think there is value in, like Dr. Strickland's saying, in having that intimate relationship with a veterinarian that's seen your livestock and your kind of farm animals to provide the best treatment plan. Well, in terms of if I have more questions, or if maybe I'm interested and I want to learn some more, where are places that people can go to get more information, or maybe read a little bit deeper in terms of what we've talked about today?
The simplest method is to literally Google GFI 263. And that will take, because I've done that multiple times just to make sure, because before I put this out there, that it works. But yeah, you can just Google GFI 263. It takes you to the FDA website that explains all this. But you're also more than welcome to contact me. I have a website, askdrlou.tennessee.edu. And that will send me a message and says, hey, I'm from Kentucky, I've got a question, or wherever, and I will answer your question through electronic means.
That's great. That's a really helpful resource, that kind of a direct line, if you will, and hopefully other people can kind of take advantages of your questions too. In terms of the over-the-counter changes to prescription, do you feel there's anything we kind of missed touching base on that you'd like to add? Or do you think we kind of covered all of the need-to-knows for now?
As far as need to know, yes, I think we've covered everything right now. This is still a fluid situation. I've got contacts in FDA. I've been trying to stay in contact with them to make sure, what changes might be, other changes that might be coming along. What are we supposed to do? And I've been trying to stay in contact with them regularly just so I can keep everyone else abreast of the situations that's been going on. So I think we've covered everything, but I think the most important thing to do right now, if there's just the one thing to do, that's establish a VCPR with a veterinarian.
I think that sounds like a great plan. And in terms of, maybe you are in more of a rural area, is there advice on just kind of Googling local vets, or is there a website, or what's your kind of support for people that maybe previously haven't had a close relationship with a veterinarian?
I know in the state of Tennessee, our Tennessee Department of Agriculture, you can literally Google Tennessee Department of Agriculture. It takes you to their website, and it has a listing of large animal veterinarians throughout the state and what counties they're in. So Tennessee has that. I'm sure that other states have that as well. So that's a place where you can start to look for them. And once again, stay in touch with potentially your veterinary medical association in your state as to what changes may come along with a VCPR, and will telemed be an option?
Those are great resources. So I'm going to put you on the spot for just a second to close out. But why veterinary medicine for you? What kind of lights your fire to keep you interested or to establish your interest in veterinary medicine? Why veterinary medicine for you?
As I said, in dairy business 25 years, I was in one of those areas that didn't have very many veterinarians. And often when we would have issues, I would kind of think to myself, golly, maybe I want to be that person that's able to go out there and help producers, help individuals with problems on their farm. And that was literally the thing that drove me towards veterinary medicine, was the desire to be able to help others with their problems, because I'm not a snot-nosed kid that read all this in a book. I did it for 25 years, day in, day out, 24/7, 365. So that was my driving force to become a veterinarian.
That's awesome. Dr. Strickland, thank you so much for joining us today.
Thank you.
I really appreciate your knowledge and expertise in this area and your willingness to kind of help get this out so that people know what to do in the coming months. But for those of you who are interested in maybe some more information, you can go to vetmed.tennessee.edu.
Thank you for joining us for this episode of Volvet Voice, a podcast that shares the stories of knowledge, compassion, and discovery that help create real-life solutions at the University of Tennessee College of Veterinary Medicine in Knoxville, Tennessee.